morning, this is Dr. Huang, West Chase Wellness Chiropractic Center. I'm going to demonstrate what a chiropractic adjustment happened in my office here, and we're going to also do a little bit of demonstration on the shoulder with a little bit active release technique on this patient here. And this patient has shoulder pain, and we're going to do some drop table technique first on him. Scoot down a little bit. And what I like to do is get his curvature, which is the neck curvature, back in proper position. A lot of us nowadays sit in the computer too long a period of time, and also we also look at a cell phone looking down, and that causes a reverse curvature on your neck. And what we want to do is, when I do that, it helps bring the curvature back. And we use this technique all the time on the patient to get the reverse curvature back. Good job here. And just the mid back, as I go down this area, upper thoracic here, we call that, it helps you with heart, lungs area of the chest, and then help you get arthritis too. And as it goes down to your lower thoracic area, it's good for kidney, great for your adrenal glands, great for stomach and your large intestines. This is a good area to get the line correctly. So basically, I palpate on the person's, or I feel for the misalignment of the spine and get the pressure back into proper alignment. Get the pressure off the nerve. The patient feels better. Now I'm going to come down to his lower back and check his leg length. His right leg is short on the left side. So we're going to use the drop-in table again to get the leg even out. Very good. Very good. Very good. Here is the sacrum. I do a sacral drop on him also. And the leg is even now. I'm going to go in this position here. His left leg is still short. Awesome there. Awesome there. Let's go see if we make that correction on him. Oh, wonderful there. It's nice and even. I'm going to compress his leg. A little tightness on the right leg itself, so we're going to correct that too. Awesome there. Awesome there. Awesome there. Here, I'm doing the lumbar adjustment, and it's good for small intestine, large intestines, your bladder, your reproductive organs all sit down here. Appendix, your adrenal, your kidneys all down here too. Your prostate for male down here, it really helps them function better, regulate better. And when those that are under chiropractic care typically deal with stress better and sleep better at night. It does help your headaches, it helps your asthma. And now I'm going to go ahead and adjust his lower back, mid back up here as we come by. All right, John, can you take a deep breath in and hold it? Awesome there, awesome. Breathe out. Very good. Good, awesome. Good. Good, awesome there. All right, John, let's get you on your side for me. Face me, please. Awesome. Awesome. This adjustment helps. We're going to adjust his lower back now and get the lower back in proper alignment again. Breathe in, breathe out. Good. Other side for me, please. Good. Right now, people have runny nose. It's raining, it's hot, it's humid. Breathe in, breathe out. Good. Let your back face up. And also, if you have any allergy issues, scoot down. Adjustment does help. Scoot down a little bit more. Good. I'm going to come right here and do we'll call a hug move on him. And it really this helps to move the back a little bit better. Upper back, that is. Just relax. Good. Good. He's a little tight, so most likely he's still not stressed or didn't drink enough water lately. That could be a factor. Muscular tightness. This is a wrist adjustment on him. Good. This is a thumb adjustment. Good. That was a good one. That's a great one there. Awesome there. That's a nice elbow one. Yes, computer work. You can tell he does a lot of computer work. Nice. Good. Good. Let's go get the ankle. Hopefully get some good loud pop here. Oh, that was a nice one. Another nice one. Awesome. Also adjust the hip. Pretty much you get a full body adjustment when you do come to office here. And this helps the knee. This helps the pelvic and the lower back with distract and do a little tug like that. Now I'm going to do is I'm going to demonstrate a little bit active release technique on the shoulder. He does have a shoulder condition. We right now working on the anterior deltoid muscle. And then we're going to the middle delt and then posterior delt a little bit. And we're going to supraspinatus after that. Start working the pec muscle. And then we will do a subscapularis with that and teres minor after that. Obviously the pec muscle is not part of the rotator cuff, but it does help move the shoulder. Very good. It does help people range of motion. We break it down. When we go to range of motion, I didn't put pressure on the muscle and strip the scar tissue and help people have better range of motion. That's a nice one. How to get them into a smoother motion to the shoulder, for example. If you're an athlete, we'd love to help you with athletes. So we can help you improve balancing, hand and eye coordination. If you play golf, that's very helpful. If you have a shoulder that's painful playing golf, this is a good way to get your shoulder feeling better and the spine. Better rotation and flexibility to golf shots, for example. If you're a football player, a quarterback, or baseball player, you got to use your arms, and this technique is great for the rotator cuff. I do a lot of nutrition in our office too. If you have nutritional needs, we can help you with that, especially in pediatric and pregnancy adjustment. It's called Webster technique, and also I'm certified in chiropractic, applied kinesiology also. There's a muscle testing style adjusting the spine. Oh, he's making a good looking face right there. When that hurts, that means it's kind of painful. We do the Y strap in my office too. It's a manual decompression of the spine. Wonderful. Then we'll go down to the teres minor area and get that area working better. This happy smile is happening right now. This happy smile. Ooh, nice. All right, there you go. Now we're going to transition to the Y strap. It's a great way to get the pressure off the spine. I call myself the Houston Asian dinger, because we're helping people get the pressure off that nerve and decompress the nerve right now by the Y strap. And this distraction does take the pressure off the spine. It does feel wonderful. Right now I'm just kind of get his body stretched out a little bit before I provide that thrust. And that's the thrust that we're going to do. It's amazing. Go back down here. And we do adjust the neck afterwards. And after that, I'll adjust his shoulder. Just relax. Thank you. Just relax a little bit. Thank you. That's a baby one right there. That's a little bit more. Good. Very good. I adjust the ear also. By the way, I also could work on people with TMJ also at the same time. Sit up, probably turn that way. Good, don't move. Adjust your shoulder next. Just relax. Oh, that's wonderful. Awesome. Just check his range of motion again. It's really nice, actually. A little restricted on the left. Awesome. All right. All right, John. Tell the world how you've been. Before you do that, please like us, hit the subscribe button and notification button, so we know that you really like our video. And he's going to tell you how it's been doing since he's been coming to office.
In about 2, maybe the 3 weeks that I've been here, my range of motion has increased. Before, I could only go this high with my arm. Now I can go almost fully a full circle. My sleep has improved. Walking has improved. Even my handwriting has improved. So it's worth it.
Wow. Wow.
Yeah.
Please come by and check us out. Thank you.